young professionals are urged to prioritize health insurance from the beginning of their careers. But how do you convince younger people to plan for future medical expenses and how to choose between a hospital plan and a medical aid? Well, to discuss this, we've got Sarah Bennett, who's the functional specialist at AfroCentric Group. Thank you very much for your time this afternoon, Sarah. One of the first things, as I remember myself when I started out my career, was that the options weren't as varied, but also the cost was quite high. So as a young person, fresh in your career, how do you make a decision between a medical aid or health insurance, as well as the costs associated?
Absolutely, Cindy. And it is a bit of a minefield out there. There's so many schemes, there's so many options. But I work for AfroCentric Group and a company called MedScheme, which is part of the group. And we administer medical schemes and we provide managed care services to about 4 million lives in South Africa. And there are about 15% of the population who are covered by medical schemes. And there are a lot of medical schemes to choose from, and each medical scheme has a number of different options. So it's important that people evaluate the cover available and look at what is available and meets their needs.
And how important is it to be prepared, Sarah, for medical emergencies? I suppose you'd have to think about the fact that getting medical assistance is not cheap and one would have to be prepared.
Absolutely, and medical emergencies can happen anytime. We see, for young people, we call it the accident hump. We do see kind of risky behavior amongst young people, and we do see more accidents. And it's absolutely critical that if you can afford cover, do cover yourself. You never know when you might land in hospital after an accident. And it's not only accidents, it's also other trauma, violent injury, and also heart attacks. Heart attacks also affect young people. So it's absolutely vital that you are covered.